And my role in there over the last 9 years has all been around alcohol prevention and public health programmes of work I'm commissioned by the local public health team. And for me, this question about are drug and alcohol users' needs best met by services sitting under public health, it raises, probably the first question for me is around looking at a public health model. So a public health model, I think, is really well fit for meeting the needs of alcohol and drug users. Not all services might sit under public health commissioning, and that's where, certainly for alcohol, we know that the estimates of 1 in 4 people have some kind of need around their alcohol use, whether that's low intensity, like screening or brief interventions, all the way to high intensity of specialist treatment. And that's going to involve then a public health model that might involve specialist services commissioning under public health, but also will involve lots of other services presenting it in different parts of the community, primary care, mental health services, involving health visitors, social workers, GPs, practice nurses. So I think in the broadest sense of public health, around individual behaviour change interventions, it is broader than services just might sit under public health commissioning. And then the other part that I've been particularly involved in my role over the last few years since the Licensing Act changed in 2005 is also looking at then population approaches to public health, which is almost going back to a classic approach of public health and looking at the environment. And I think that's where, again, meeting the needs of alcohol users, or particularly around prevention, that there's a phrase that often gets used around tackling industrial epidemics and how can we actually look at then corporate activity that might be driving ill health or disease, and particularly around kind of alcohol sales and availability. And so that's that bit, I guess, for me around meeting the needs of alcohol users, particularly. Yes, it's individual behaviour change interventions, and also we need to have kind of a population-based approach too, and looking at communities and cells and outlet density, all those things that we'll probably get onto this afternoon.